Namaste. Today we will study about one of the most common thing that is affecting people is hemorrhoids or piles, and we will see the homeopathic management of the hemorrhoids with the help of cases. You should know some basic things about hemorrhoids. First of all, the term hemorrhoid is an unqualified term, meaning is that hemorrhoids are effusions, they are vascular effusions which helps in continence of the stools. So hemorrhoids is the term which is used. Normally what we understand by hemorrhoids is what it is a disease condition, but it is not so. Hemorrhoids, or they are also called as piles, these are vascular effusion structure anatomically present in the anus. These structures helps in contracting the anal sphincters. 20% of the pressure is provided by these structures. They are neither arteries nor they are what? Veins. They are specialized blood vessels called as sinusoids. Now when these structures get infected or when they get diseased, then they are called as what? Hemorrhoids. Now they say that it is more common after the age of 45. People who are between 45 and 65 years of age, they have a tendency to suffer from this condition. But nowadays it has become very common. Right from the young age you will find people suffering from hemorrhoids, and in my opinion the main cause of young people getting affected by this condition is because of what? Prolonged intake of allopathic medicines. You take the allopathic medicines have become so much potent, or you can say they are chemically so much potent that you take allopathic medicine for anything, and what will happen? Earlier it was what? After prolonged use of allopathic treatment, problems used to arise. But nowadays, you take allopathic treatment for simple, you take antibiotics for 2 or 3 days and you get what? Gastric upset. Every time a person of hemorrhoid comes to me, there will be a history, prolonged history of what? Allopathic antibiotics intake, and their complaints always get aggravated after intake of allopathic medicine. They might be suffering from cold or coryza or simple fever. They take the allopathic medicine and then what happens? The problems of the piles gets aggravated. Now piles are of two types. The internal and the external. There is one line, pectinate line in the anus. The hemorrhoids, the sinuses present above the pectinate line is the internal hemorrhoid, and below the pectinate line is the external hemorrhoid. Now the internal hemorrhoid, when a person suffers from internal hemorrhoid, there is generally bleeding, bright red color bleeding, and there is no pain. When a person suffers from external pile, then he suffers from what? severe pain. If there is thrombosis, there can be very, very severe pain. Internal piles, when they, prolapse, and when there are 4 grades of the internal piles. So if it comes out of the anus and it doesn't recedes back, and then the thing gets infected, that can also give rise to what? Severe pain. Now, 50 to 60% of the population suffers from pile in some part of their life, but generally the piles heal on their own. This is the reason why, unqualified homeopathic people or any person who is just reading books on homeopathy, and if a person comes for bleeding, for example, if he is suffering from internal bleeding, the bleeding occurs in 15 days, in 1 month, the bleeding occurs for 1 or 2 or 3 days, and then the bleeding stops. Now this person, it is a natural occurrence. Now if this person is giving homeopathic remedies to any person, I mean if a homeopathic doctor is giving and he is taking credit for curing such a type of hemorrhoids, he is doing nothing. Don't take credit for such things that homeopathy has cured the patient. It happens on its own. We don't know the cause of hemorrhoids. Medical book says it is more common during pregnancy because the weight of the fetus pushes the sinusoids or the cushion little bit downwards. So in case of females, what happens? The pregnancy is one of the common cause, and there are other causes which they say the exact cause is not known, but they say constipation can give rise to hemorrhoids, or recurrent diarrheas, lack of exercise, not eating on time, and not exercising. These are the things which predispose for a person to have what? Piles. But the exact cause is not known. The cushions, they slide downwards, and that is why, and they get infected. Then when they get infected, then we say that what? The person is suffering from piles. Now, I will explain everything on cases. Homeopathic science, which nobody follows the laws of homeopathy, in real cases, a person suffering from 10 to 12 years of piles, prolonged suffering, such cases cannot be cured by the pathetic homeopathic prescription of combinations, and it cannot be cured by patents. If the person is really having the disease which requires medicine, then only classical homeopathy will cure. So people who are reading books and they are giving 3 or 4 or 5 remedies for what? A person is having got bleeding. It occurs on its own, it subsides on its own. Your medicine hasn't done anything. So, if the person is really suffering for years together, and then you cure that person, then you take the credit as if what? That you have done, your remedies have done something. So, take this example. This lady is suffering from piles. She has consulted me 1 month ago. This lady is suffering very much due to hemorrhoids. You can see in the video how
अच्छा
वो पीछे बड़ा सा है
हाँ
और ये एरिया छोट छोट हल्का हल्का।
अच्छा
हाँ।
अगर तुमसे हम पूछें कि तुमके खजूली ज़्यादा होले कि अगियाला ज़्यादा कि दर्द ज़्यादा होला तो का बतेबो?
ऐसा ने खजुहाट उभरी वही से दर्द और जलन
पहले खजुआहट हुई तो के
पहले खजुहाट हो।
तब खजुलिया जैसे खजुआ दहलू अगर बर्दाश्त के बाहर हो गए
हाँ।
तो खजूले के बाद खजुलिया चल जाले कि और बढ़ जाले।
तब जलन बहुत रहा था अगिया।
अच्छा, जब खजुआ देबू तो आगे आई बहुत।
हाँ, जलन रही और तब वो घबहा हो जाता है। बाकी बहुत बढ़िया जब ना रहिए तब खजुआ
नहीं वो मन इतना खजुली होले कि आदमी के बर्दाश्त ना होला,
बर्दाश्त
यही माले
ना।
पूछत हई। ठीक हवे। अच्छा ये बतावा कि जैसे लैट्रिन लगल हवे और ना जात हो तो ओकरे पहले से दर्द चालू हो जाई।
Now she is showing the entire anal canal. You know, she is having 5 protrusion at 5 to 6 places. You can see that she is showing it what on her finger, and she is having very severe pain. She cannot sit.
कैसे का करेलू?
ये तर बैठ ना पाई।
लैट्रिन में जैसे बैठल जाला तब।
हाँ,
हाँ।
ये तर ने इसन आधा घंटा हम 20 मिनट ना बैठ पाई।
हाँ।
हाँ, उठ गई थी।
अच्छा, उठले में भी दिक्कत होले ऐसे है?
हाँ।
तो खाना वाना ना बना पाओ कुछ भी?
ना खाना ना बना।
तो के करेला घर कमवा?
बात एक लड़की करा दिन खाना वाना बनाओ दिन
हाँ।
और तो नहीं तो झाड़ू मार दे।
झाड़ू मार पावेलू?
हाँ, नहीं तो झाड़ू मार।
अच्छा, तो जैसे बताओ खाली उखड़ू ना बैठ पावेलू?
ना ये तो बैठ।
और हेमन बताओ तो रहलू कहाँ कहाँ गठिया हो बतावा, ऐसे उंगली एक बताओ तो रहलू ना
जैसे ये
कहाँ कहाँ हो?
She hasn't been working due to the pain, and the pain is so severe that she gets vertigo due to the pain, having a tendency to fall on the right side. Now, these cases, such cases cannot be cured. You can see she is taking treatment since 12 years, and what she has come out with. This thing, you know, what you see in the video, this is the pathetic homeopathy.
ना मिलेला?
नहीं।
ठीक है, तबे 12 साल हो गेल ने, तबे 12 साल हो गेल ने। हाँ, रखा।
ये वाला दूध ने?
हाँ।
ये वाला दूध है जब खाई थे हमें दर्दिया हल्का भरा, दर्दिया खत्म ना रहा कि नहीं दर्द।
हाँ, हल्का होला।
हाँ, ये से हल्का होता दर्द ज्यादा ना।
ठीक है। और कुछ रख ले हऊ?
अरे वाला ये मलहम दे रहा।
ठीक है, मलहम भी हवे दा दिखावा। ठीक है, तो इतना दवाई तो आप कितना साल से चलत है? 3 साल से कि 12 साल से?
पहले ने
हाँ
3 साल पहले ही दवाई चला रहा, तब वो नहीं डॉक्टर के यहाँ आराम मिल गया।
हाँ, ठीक है।
छोड़ दे है दवाई आराम मिल गया।
हाँ हाँ,
तो ये दवाई फिर वन चलाएंगे।
अच्छा,
तो अब आराम में ना मिला।
ठीक है। आराम ना मिले था?
नहीं
मिली, आराम मिले। ठीक है, ठीक है, रखा भाई। हमारी दवाई चली तब कुछ ना चली है, भाई कुल ना खाएगी कुछ भी। राहत रही यही माले कहा था ना। हाँ, ठीक है।
Giving of patents, giving of combinations is not going to cure her. Cases which get cured by patent medicines, which get cured by what? Combinations, which get cured by giving anything to the patient, generally they don't require any medicine. If you don't give medicine to that person at that particular time, then also it will recede back in 2 or 3 days. So, now this lady, she is having, so much problem. And when I took the history, it all started at the time of her delivery. When she was carrying in the 7th month, she developed piles. Pregnancy is one of the factors that gives rise to piles. Now this lady, at that time, she was having the piles after the delivery also, she was having the piles off and on. She used to take medicine. and what happened? It used to subside. In 2014, what happened? She met with an accident where she broke one of her tooth, and she took medicine at that time, but after 1 year, what happened? Some part of the tooth remained in the gums, and she started discharging pus, and it was so much severe that it required surgery. And she was bedridden, and the abscess was so huge that the treatment took 4 months, and the dentist removed all her teeth. I mean, the incisors and the canines, all teeth were removed. And she was telling me, during that period, it was so much deep that bandage has to be inserted so long. I mean, she was showing, at least a feet long bandage was being inserted inside her gums, and that took place for 4 months. And you can see in the video, she has...
और करा और यहाँ से करा एमन दर्द वर्द ना होला कुछ निकलला ना एमन से
कुछ ना निकलत
कुछ ना निकला मुंह खोला नहीं मुंह खोला जीभ बाहर निकला है खाली यहाँ बाईं तरफ दर्द होला
हाँ
developed what? Fibrosis. You can see the gums have healed, and it has developed what? Fibrosis. Entire, upper gums also and the lower gums, and she cannot put the finger inside. She cannot brush the teeth on the left side. She is coming to me with what? Complaints of piles. Okay, but in homeopathy we consider what? The entire totality. Right from where the complaint started, then and then only this woman will get result. So, after the surgery, and after this surgery took place, she developed a very severe piles. It was in 2014. It has been 6 or 7 years of her suffering. And it is very, very, the suffering is very bad. She, when she was talking to me, I could feel the pain on her face. It is so much, the condition is so much painful. And it is, when people suffer from such type of piles, it is really, really very much, the condition is very, very bad. Now, after this, after the surgery, naturally, at that time, just imagine the quantum of the allopathic medicine given to treat the condition, the surgical thing, and naturally after that she developed what? The piles become very severe in her case. Now, there is pain. In homeopathy, we don't only see what? You don't prescribe only on the pain. You have to ask what type of pain. Okay, so this lady, see, these are the things I am telling you. But in reality, it becomes very difficult to extract the symptoms from the patient. So this lady, she complains of what? Sudden biting pain. As if she says, somebody has bitten me. And when this biting pain she experiences, she stumbles also. The pain is so severe. It will come suddenly and it will go suddenly. Another pain she experiences is what? There is crawling sensation in the anus. She cannot sit when it gets aggravated. She gets, she is showing me, all these treatment, homeopathic treatment she is doing since last 4 or 5 years. You cannot cure by the pathetic homeopathy. This type of homeopathy, this is not homeopathy at all. You cannot cure. With these medicines, you can cure only things which don't require any medicine. Everything will work over there. So, the pain is like this. On further inquiry, you can see there is fibrous condition of this one. This is also one condition in her, and this fibrous condition, she feels heavy on the face, and if she carries weight all her problems increases. If she cannot carry weight on her head, see, they are farmers, labor class, they have to do the work. So, when she carries weight, you know what happens? She feels a load right on the left side of the face. And her problems of piles also increases by carrying the weight. Along with this, the lady suffers from pain in the left heel since 2 months. And considering all these things, I mean, I have the entire case recorded in audio form. So, people who are interested in learning homeopathy, how to take the case, how to elicit the symptoms, can subscribe to my app for learning purpose. So, after considering the entire case and taking the totality, you know, I prescribed for her, and the third day, her husband called me up and she was experiencing what? Very severe aggravation. They were in panic condition. The aggravation was so much that they were rushing her to hospital. The pain was so severe, that was what? Aggravation by my medicine. When you treat such cases, then you get what? After prescribing the remedy, you can see aggravations, you can see amelioration, you can see prolonged aggravation followed by amelioration. You can see short amelioration followed by aggravation. And these things require what? Different steps to be taken. What will be the next step? People don't get, you know, aggravations. They don't get any rules in the treatment which they are doing, homeopathic treatment. Why? Because they are treating people who don't require any medicine. The case can heal on its own. In such cases, you will get every law of homeopathy. And she is coming after 1 month, and you can see that, you know, she got complete, you know, the aggravation was so much that the entire piles, she is having the 5 or 6 knots. You can see on her finger. Anterior, posterior, she is having everywhere. Such huge. And the aggravation was with very severe pain, and there was protrusion. Everything came out. She couldn't, you know, walk also. She couldn't stand also. The aggravation was for 2 or 3 days, you know. Anyhow, when they called me, I told them, I mean, just wait. And they waited. The second day, you know, everything was ameliorated. She was ameliorated after that, continuous amelioration. This is her second consultation. You can see in the video.
हमार तो जब पहला फाइल पियत रहे ना, तो पूरा जैसे आराम रहा, काम उम करत रहे। जब दूसरा फाइल चालू है, तो अंदर से पूरा बाहर आई गिरा।
अच्छा।
हाँ, तब बहुत ज्यादा दर्द रहा है, उठ
फोन कैले रहलू।
हाँ, फोन बहुत परेशान रहे वही पर। तब ओकरे बाद पिए दवाई तो धीरे धीरे सुखा तो छोटा टाइम हो गई, इतना टाइम। तब ओकरे बाद तीसरा जब
कितना हो गया?
अब इतनी देर फिर जब अंतिम वाला जो फैलिए पिए ने, फिर उभार करे बा।
नहीं तो पहले जैसे दर्द हो गया, पहले से कम बा?
हाँ, पहले से जितना दर्द रहा उससे बहुत कम बा। पहले तो इतना रहा कि हम उठ बैठ ना पावत। अब उससे आराम बा, बाकी फिर इतनी देर उभार रही। पिछलकी वाली फैलिए पिए से,
आखिरी वाली से
हाँ,
एडियम दर्द रहे वो कैसन हवे?
वो सही बा,
वो सही हो गया।
वो वाला ना दिक्कत।
सुबह के टाइम तकलीफ रहे ना, वजन उठावले से तो तकलीफ होत रहे।
हाँ, एक दिन थोड़ा हमारे 5 साल की लड़की हो, तो क्यों साथे दवाई ना, वही दवाई कौन है लग गए रहे ना, तो पता नहीं वही को वजह से हमें फिर उखाड़ कर दे कि काहे के उखाड़ कर दे।
हाँ, अंग्रेजी दवाई ना खाई ले रहलू ना?
नहीं।
आई देखा बा एम्मा कुछ कमी आइल बा?
नहीं, एम्मे नहीं। ऐसा डॉक्टर साहब जब आ रहे तो की है, ये हर अंगुरी ना जाए।
हाँ,
एकदम सूजन ये नीचे लटक गया।
अच्छा
अब तो ये पूरा चला जात, हम नहीं तो मंजन ना कह पावत रहे,
मंजन ना कर पाओ
अंदर अंदर घुसबे न करे, ई चौभर देखात ना रहे।
हाँ हाँ
अब पूरा देखाए ला,
पूरा ब्रश जाला अंदर ले आओ,
हाँ, अंदर
आई
तक
दिखाओ उठा के, मन कुछ कमी ना लगा थियो।
ना ही सूजन तो बहुत कम हो बा, अब दर्द उर्द ना रहा था।
पहले दर्द रहता
हाँ,
रहे,
पहले जो बोझा कोनो चीज ऊपर धरी ने
हाँ।
तो हमें जैसे यहाँ तक वजन लगे, दर्द मालूम महसूस हो।
हाँ हाँ
अब ना हो दर्द,
ना हो तो ना,
नहीं।
ठीक है।
And the fibrotic condition, here earlier she couldn't put the finger or a brush on the left side. Now, the swelling has reduced so much that she can put the brush and the finger goes up till the end. And the pain in the heel has disappeared. Now, everything was going on well. Okay, now what happened? She has got a child of 5 years, and this child, he fell sick. And she carried the child to the clinic, to the doctor, and when she returned back, she has got what? Aggravation. Aggravation means what? Again she developed some problem, some pain, not the intensity as she was having earlier, but she was completely relaxed, and now again she is having what? Mild pain. So what has happened over here? Amelioration was going on, and suddenly what happened? Aggravation sets in. Though it is 10% or 20%, but just imagine a person who is very much relaxed, she is now working and she is doing everything fine, she is not having any problem, and the scare, if she has got a little problem also, the person becomes scared. So again what will happen, now see, what has happened, the patient was experiencing amelioration and aggravation sets in. Then you have to inquire to the patient, what happened? Why did the aggravation set in? So here what is happening, she is saying, I carried my child to the clinic, and when I came back, what happened, my complaints were aggravated. Now here what has happened, the exciting cause has been brought about. So you should tell the patient that, you should not lift weight at least till the time you get well. And the next step will be what? After considering the symptoms, remove the exciting cause, and then again either you repeat the medicine or you change the remedy. The remedy which you are changing, suppose you want to change the remedy, it should be what? Complementary. It should be what? Chronic. This is how homeopathic treatment happens. This is how homeopathic cure happens. Homeopathy doesn't happen just you what? Take the rubric. Whatever rubric people take, if you are presenting a case and you cannot show me what are the symptoms given by the patient that you are considering in the rubric, I don't want it in your words. I want it in the patient's word. What is the patient telling you? Then I will know. All the maximum cases are what? Maximum cases are fake. I am telling you, cases which don't require any medicine, they will say, I have cured piles. They might not know what is the meaning of piles. And this is how maximum of the cases, 70 to 80% of the cases, if a person, changes his food habits, such 50 to 60, they have given in the medical books, 50 to 66% at a time, the population suffers from piles. But without any treatment, they become normal. So when you are doing haphazard homeopathy, when you are giving combination, pyronex and whatnot coming in the market, just remember, those things don't cure. The person is getting healed on its own. Present real cases which require medicine and present the cases on the patients. You don't have to write in words. I know, 25 years of experience, I know what is a fake case and what are things required by the patient. Which patients require medicine? Homeopathic doctors must first, when they are presenting the case, first they should discuss, is this patient really requires medicine? Has he become well on his own? And then you proceed further. And if you are presenting the case nowadays, with the advancement of digital technology, whatever language it is, show me the conversation of the patient. You come out with mental symptoms. In my 25 years of practice, I don't get any mental symptoms. Patients who come to me, they are having very severe problems and they talk about only what? Their physical problems. For example, this lady. How can you come with the mental symptoms? And they write what? A case of piles with lots of mental symptoms. Simply, a person who is not suffering, he has got lots of time to talk. When a patient is in pain anywhere in the body, do you think he will talk nonsense about the mental symptoms? No. Which patients give you what? Fear of darkness, fear of dogs, fear of this thing, fear of that thing. These are the people who are not having any problem. Then they have got lots of time. People who give mental symptoms in cancer patients, let me tell you, they haven't seen a cancer patient. There is so much fear. There is so much anxiety. The patient talks only about her pain and no type of mental symptoms come. So that is the reality of homeopathy. Rest, if all problems in homeopathy will be solved if you just present the cases as it is. How did the patient come to you? What the patient is talking, whatever language, you record and show me, and then you show me what are the symptoms this patient is giving and how you have taken the symptoms.
बताओ फिर से।
जैसे ये दतवा जवन दोनों खाओ,
हाँ,
तो ये सूजनिया रहा तो मसिया ये बाहरवा भर रहा सूजन से,
हाँ,
अब वो अंदर चला गया।
अच्छा।
अब थोड़ा अब दतवा छोड़ दे सूजनिया।
देखावा दतवा लौकात बा, मतलब पहले दतवा लौकात ना रहे।
पहले ये दतवा ऊपर मसिया रहा।
दांत के ऊपर पहले मांस था।
नहीं,
हाई दांत लौकात बा ना, पहले ना लौकात रहे।
ये दाजवन ने मसिया बाहरवा लटका रहा, अब ना लटका।
अच्छा,
ऊपर गमा सब जाता।
ठीक है भाई। और अंदरवा सूजन कुछ कम मालूम पड़त बा, सिकुड़त बा।
हाँ, अब पहले रहा जिभिया डोले ने,
हाँ,
तो अब यहाँ से जीभ लावत है ही खाली दिक्कत हमें आवत है।
अच्छा,
सो जाओ और यहाँ ना दिक्कत बा।
यह सही पचक गयल बा तोहार।
हाँ, पहले ही कुल छापे रहा थे अंदरवा जिभिया डोल के नहीं आवे।
हाँ,
अब है ही
मतलब जिभिया ऊपर ले जा पावल हुआ।
हाँ, अब यही खाली ने
ऐसे मतलब ऊपर करा था। ठीक है, ठीक।
ये पहले रहा